With low vaccination rates, high COVID transmission, and many people dying, Idaho is the most dangerous state for COVID safety. That's according to a study by WalletHub. The Gem State is seeing its highest hospitalizations since the start of the pandemic.
Numbers are starting to trend down, as you can see towards the end of this graph here. But relative to the rest of hospitalizations during the pandemic, things are still not good. More people are still in the ICU and on ventilators than any other time in the pandemic. Eleni Dow gives us a look at how Idaho got to this point and where it's at in the crisis.
North Idaho hospitalizations continue to remain high. Panhandle Health says in its 5 counties, 132 people from North Idaho are in hospitals. Kootenai Health has 119 COVID patients in its care. The medical center has continuously had more than 100 people hospitalized for more than a month now, and they're not sure when it will get better. 19 months later, it's still an uphill battle with COVID-19. It's been a tiring, difficult fight for Idaho. Tomorrow marks 1 month operating under crisis standards of care.
I'm here to tell you that we've lost the war, that COVID is here to stay. And the reason it is here to stay is because we cannot vaccinate enough of the public to fully eradicate the disease.
About 56% of Idahoans 18 and older are fully vaccinated, 12% lower than the rest of the country, which is at 68%. Unvaccinated people are filling up hospitals. Of 12 COVID ICU patients one doctor saw at Kootenai Health earlier this week, all 12 were unvaccinated.
Frustrating from a healthcare perspective to know that probably many of those patients don't need to be there. And many of them realize that they probably should have done something different prior to getting there. It's a very frustrating to see their suffering and to take care of them.
Low vaccination rates, high rates of transmission, and too many deaths. This is what landed Idaho last on the list of safe states during COVID. And healthcare workers are battling patients who don't believe in COVID or take it seriously.
I feel numb to it now. It's just not even. For a while it was, how can they truly believe this? What can I do to expel that myth? Now it's just numbing.
Getting out of crisis standards of care is still a distant future for healthcare leaders. Too many people are being hospitalized and not enough staff can take care of all of them. They hope things that get better, but don't know when that will happen. In studio, Eleni Dow, 4 News Now.